Hi and welcome. Today I want to talk about centralization. It's a McKenzie exercise. We put the lower back into extension like this as we're on our stomach. By doing so, we are changing pressure that is on the nerve root to come off. By changing the force of the disc within the nucleus pulposus, when that nucleus is protruding backwards against these nerves in the lower back, we're going to decrease that pressure and allow this particular technique to get irritation off that nerve root. Centralization primarily means that we're taking pain away from the lower back and maybe in your leg or in the calf or down into the foot, tingling, numbness, cramping, burning. And by going in this technique, we are trying to reduce all that pain on the outside and bringing it more centered in the inside towards the spine. So when we look at the lower back, we have 5 lumbar vertebrae. In between the vertebrae, we have these discs. Here, this shows you a bulging disc right here. As you can see, the redness coming off the part of the vertebrae irritating this nerve. Understand the purpose of this technique is to put the spine into an extension position, but realize that when we spend a lot of our time leaning forward, picking up things off the ground, poor posture, this forward position causes compression on the front of the discs. That compression pushes the inside of the nucleus, the gel, backwards towards the back part of the spinal column or spinal cord, and that's what usually weakens and irritates the outside fibers called the annular fibrosis of the disc that causes disc bulging and disc herniation. The end result is irritation on the nerve. This technique, as we put you into an extension position like this, as I show you the technique, we're going to hopefully correct a lot of these problems. What I'd like you to do is just lay on your forearms like this as if you're doing a plank, okay? Your elbows are bent 90 degrees and your arms are on the table like mine. Now what I want you to do is I want you to lift your upper chest upwards, just like this. And as you lift upwards, you're gonna feel stretching of your ab muscles in front of your abdominal area, but you're gonna extend the lower back. And as we extend it, what I want you to feel is if any of your pain or tingling or numbness away from your lower back is starting to dissipate. And if you feel better, like in your leg, your ankle, your knee, your calf, or your thigh, or actually into the buttocks area, and if you start feeling that starting to diminish, you're gonna hold that position. Now, what you're gonna do, if you notice that you're in this position and you don't feel any change, I'm gonna have you lean over to the right side. As you lean to the right, and now you'll start extending backwards and hold it in that position. If you're feeling progress and you say, hey, listen, my pain is diminishing away from my lower back, then you're going to continue to hold that position for a couple minutes, and that's the position that you're going to focus on. If I'm on the right side and I do not feel any change or the pain gets worse, I'm going to move all the way over to the other side, which is my left side. Keep it in extension, and if I'm feeling relief, this is the position that I will be in for a couple minutes as I do these exercises routinely. If it's twice a day or every day, this is the position you're going to be in. So the most important thing is finding that position, if it's going to be central, if it's going to be to the right or the left, and you feel reduction of pain, you're going to continue to do this exercise as this will help repair the disc. Once you've found the right position that you're in, either centered, to the right or to the left, and you're getting results, you can get more results in this advanced extension position. All we're going to do is just basically take your elbows, bring it like 2 inches forward, and when you go up, what you're going to do is take your elbows and pull it back as you're pulling your body forward as you get more extension and decompression. So as you're extending, you're decompressing it because your body is being pulled forward as we're opening up that disc area down in the lower back to help reduce that nerve irritation. This is a very effective exercise that you should be doing regularly. The most important thing is finding that position. Once you find that position, you stay in that position a couple minutes 2, 3, 4, 5 minutes, whatever feels comfortable, and you'll continue on that. And that should continue to cause that centralization of that pain starting to diminish, and hopefully all the pain will eventually go away. But remember, as we put it into an extension position, we're doing the opposite effect by taking that nucleus pulposus, that compression that's pushing backwards on the nerve root, and bringing it away so the body can repair and heal. I ask you to share this video, leave your comments below so those others worldwide can read it, respond to it, and actually share their ideas with you. I ask you to subscribe, and most important, make it a great day. I'm Dr. Alan Mandell.